What's the protocol for infected graft sites?
So I would say the feeling years ago was that if it's infected, to delay the grafting. Even there was a feeling years ago that not to extract the tooth right away till you put the person on antibiotics for a while. But I don't think that makes any sense. You know, if there's infection, you want to remove the infection and the source of the infection as soon as possible. So I think one of your main considerations of delaying versus not delaying are what the soft tissue looks like. If the soft tissue is just really infected and kind of looks like hamburger and kind of there's no way you can kind of suture it to place, then it would make sense to clean out the infection. Don't graft it, let that soft tissue heal for about 4 weeks, and then go back before there's been real resorption of the area, and open it back up, and you're gonna have a cleaner site, clean bone there, and you'll be able to graft it then. But the main thing about healing, both when you're grafting and not grafting, is cleaning out all the infection, the infected bone, and all the granulation tissue. So the technique there is very important. So once you get the tooth out and you've opened it up, you need to be using serrated curettes. And there are a series, here's one of them, but there's a series of 4 different ones, of smaller to larger and a little bit different angles, so they can kind of fit in all kind of nooks and crannies of that defect. And when you start, if you haven't used serrated curettes in the past, when you start using them, you're gonna actually feel the difference on the feeling of scraping against bone when you've got it clean or not. So initially when you start scraping, you're gonna have more of a smooth kind of feeling when there's tissue there. And then once you really get in there with a lot of force and you really scrape, you're gonna feel the roughness of the bone, and you ideally wanna be actually removing that surface layer of bone, because that surface layer of bone has bacteria that has infiltrated into that layer, and you're not gonna get good bleeding out of that surface layer if you leave the infected part of the bone there. And then the body would have to deal with fighting that infection before it deals with growing new bone. So you want to be sure you're getting in there. You can also use surgical length burrs, round burrs, at a kind of a slower stalling speed, and you can just kind of get into the nooks and crannies, and it'll just kind of grab that and spin that granulation tissue. So you want to be sure you're getting good bleeding in the socket and that you've cleaned it all out. Then be very careful also to rinse out all the little particles and all the stuff. You don't want to leave that behind. So get a monojet syringe, use saline, get in there and really squirt it out. Some people feel that using like a metronidazole kind of mix and putting it in there. And I've tried that, and I really honestly can't tell the difference when I use it or don't. So at this point, I just use the sterile saline and really give it a good rinse out 2-3 times. That way you make sure that the infection is gone, you're going to get good healing. Then if you have adequate soft tissue, then you go ahead and graft it, and then use your normal procedures for grafting. If there's a big defect, use a membrane, and use your regular technique then. But again, overall, there's really no reason to delay. When you have an infection, you want to get in there and you want to deal with it.